I'm Larry Barkelhammer, and welcome back to mindfulness-based mastery practices that improve health and well-being for people living with chronic diseases or medical conditions or any disabilities. This is a 7-part series. This is part 3 of that 7-part series, community and social support. This is one of the aspects that I had mentioned that the researchers found correlates with health and well-being. There's been a lot of research on this, and I'm not going to go into the statistics at all. I don't want to put you to sleep. This is Dr. Dean Ornish, a cardiologist who is known for the Ornish diet. He also has said other things, and I was very intrigued hearing him once say he believes that the support group, participation in the support group, social support, actually may be every bit as important as the diet. There are a lot of books that have been written about this topic. This is just one of many. But I want to tell you about a couple of studies. This one is the most referenced study. It's known as the Alameda County study, where epidemiologists researched 7,000 residents in Alameda County and followed them for 9 years. And they controlled for every imaginable, possible confounding variable. And what they found is that after controlling for all these variables, the people who had the most social support, the most friends, the most connections, were the most involved in community, they had greater health and well-being than the people with the least social support. One of the things that makes this study so powerful is they not only followed the 7,000 people for 9 years. At the end of that, they did another 8-year follow-up of the remaining people they could get a hold of, 6,848 of them. And they got the same results in the follow-up. The second most referenced study was by Dr. James House, no relation to my favorite TV character, Dr. Gregory House. He did a 10-year study following 2,754 residents of Tecumseh, Michigan. And just to give you an example of why these studies are so important, anyone with any medical or psychiatric condition that could possibly interfere with their ability to be socially active was excluded from the study. And despite all the tight controls, they still came up with the same results. Social support matters. Imagine being in a time of grief and not having support, social support. It's unthinkable. We all need social support in those times. There was a time when people lived in small villages. Before everyone, now, in the 1800s, people started moving into cities and working in factories, but there was a time when people lived in small villages, living and knowing everyone in town, working together. They were in multi-generational families, often living in poverty. But you know what? They were financially impoverished, but the support they had, I think, was much better than what most of us have today. Think of all the young people today living out their lives in social media. It'll be interesting to see studies done comparing the social support they get through social media versus the social support that was received a couple hundred years ago from people who lived in these small communities, working together. A lot of researchers think social support is as important as food and shelter. There was a study done in San Francisco in the 1970s where a group of men had just moved from Tokyo and settled in Japantown in San Francisco. They readily they fell in love with American fast food. At that time, American fast food had not yet invaded Japan. And they just loved American fast food. But you know what? Despite the fact that their diet was vastly inferior to the diet of traditional Japanese, who they left behind, they were actually proven in these studies to be healthier than the average American who was eating the same diet. Why would these guys be healthier than the rest of the American public who were eating the same fast food diet. It was because the researchers concluded after studying these men is that they didn't speak English. So that forced them to stay in a tight-knit community. And they were so close, they had so much social support, that it was the social support factor. And by the way, in Japan, especially back in the 70s, the Japanese were not only eating a healthier diet, but they had tight-knit communities. They had families who supported each other, and yet they were even healthier than the Japanese counterparts they left behind. Elders have to find a way to be in community. There is nothing worse in the senior years than the isolation many of them experience. Go on trips together. There are many ways to do it. They can even do volunteer work with people. There's something about reaching out and helping other people that puts you in community. I love this quote by Ram Dass, and this picture of an adult holding a hand, leading a child down this path. We're all just walking each other home. That is important for health and well-being. We can't be healthy living in isolation. Volunteer work is a wonderful way to experience social support, working together in community. Going into psychotherapy is another way of getting support. You need support. This is an experience I think everyone has had at some point in their lives. Just imagine, call up a memory of when you experienced something like this and how wonderful that felt. When you recall how wonderful that felt, it's easy. I think it's easy to get a sense of why people with social support are healthier than people without it. It just calms the nervous system. It does more than that. It makes you feel valued and like that you matter. And these things matter in terms of health and well-being. There are support groups, group therapy groups. You can get involved collaborating with people, serve on a board. Whatever it takes, find community. So in part 3, what I told you about the power of social support and the need for social support. In part 4, we're going to explore the use of the imagination and how the mind can be used to improve health. I have a lot of resources on my website, and I want to invite you to visit the website. I want to thank you very much for your attention.